I'm Professor Bazuaye, a hematologist and a stem cell transplantologist from the University of Benin Teaching Hospital from the ancient Benin Empire. I want to stand on existing protocol, the senator, who is our special guest, and all other distinguished honorable members. I want to say I'm very privileged to be in Port Harcourt. I've also been privileged to speak at the Lagos gathering in 2014, World Sickle Cell Day, in Abuja 2015, in Ghana 2016. I'm also privileged to be here in 2017. I want to thank Ifoma for the work she's doing. It's surprising that I got to know her this year, but I have so much passion for sickle cell disease that the passion took me to Switzerland to learn the act of bone marrow transplantation. In Switzerland, I was among one of the stem cell transplantologists doing transplant for both sickle cell, blood cancer, and the remaining things. But that is doing transplant in a country where it's not your own. And it was published that transplant cannot be done in developing country because of so many problems. And I returned back to Nigeria in 2010 and performed the first successful stem cell transplantation in 2011. Briefly, we'll say that the first reported case of sickle cell was in the year 1910 from a medical student in Chicago. Not even in, we've been having them as Ogbanje and every other thing, but in 2010. In 1910, it was reported in Chicago. It's inherited as mentioned. These are the complications, but Nigeria parades the highest number of sickle cell disease in the world. 2 to 3% of Nigerians have sickle cell disease. And 25% of Nigerians are carriers of the hemoglobin AS. This is the major problem. Cells refuse to pass through small vessels, and they block them. And whatever they block, the terminal part of it, if it's the bone, you have bone pains. If it's the eyes, you can get blind. If it is the liver, you can get liver problem. If it's the kidney, you can get kidney failure. So the complication is to every organ because of this problem of the cells on the left side that sickles. Next slide. This is the distribution of sickle cell in the world. The color that is orange is where the belt of sickle cell, and you can see that Nigeria is in that map. Next slide. These are several complications. The complications can range from leg ulcer, damage to the bones, stroke. 10% of sickle cell disease patients in children will have stroke, just like you have hypertensive patients. Why about 4% of adults with sickle cell disease will have stroke? And I will tell you that my first patient that I transplanted had stroke. Next slide. How do we manage sickle cell? The first thing, as demonstrated by everyone here, is prevention. Prevention, they say, is better than cure. If I and the hematologists I have trained in this country, we are doing transplant every day, we still cannot take care of all the sickle cell disease patients in my lifetime. So it means that I'm joining others to say that we need to ensure that we do not produce more sickle cell children in Nigeria. That's why prevention is the first. The next is prophylaxis. They also mentioned that you need to go to the hospital. Why do we have people 69? The oldest sickle cell disease patient in Benin that we treated died at the age of 82. It's one of the oldest. But it's because medicine has improved. But improving, despite that, we know that 70% of Nigerians stay in the rural areas, and they do not have the funds for this treatment. Other treatments include, right now, for those who are adults and we do not want to do transplant for them, we do other procedures called total red cell exchange, where we remove the blood of a sickle cell disease patient with a machine, and through the other arm, replace the blood with hemoglobin AA blood. That will resolve many problems for the adult sickle cell disease patient. We're free from crisis for 3 to 6 months. And in Europe and developed countries, they do that routinely. Next slide. The first successful auto stem cell exchange was also performed by Bazuaye et al. In 2014. I came with a machine from Switzerland and was able to perform the first automated red cell exchange for a patient that has priapism, where we remove the entire blood from one arm and replace through the other arm. Over a year, we did over 8 to 10 automated red cell exchange. This is not a cure. It is just to give a temporary relief when the patient has big problem. Even patients that have leg ulcers, if you do skin graft for patients who have leg ulcer, it will break down. The only way is do the skin graft and place the patient on total red cell exchange, the skin graft will heal. Next slide. Stem cell transplantation, which is the theme of this year's talk. It is the only cure to sickle cell disease. It's the process where you can make sure that the genotype of the child is changed from SS to AA. The first was done in 1959 by Donald Thomas. And since then, in 2012, the world celebrated 1 million transplants done worldwide. Not only for sickle cell, for blood cancers. But surprisingly, the whole sub-Saharan Africa and Asia only performed about 2% of this whole transplant. Of the 1 million transplants, only 2% was done in Asia and Africa. Next slide. However, in 2011, we broke the jinx where Professor Bazuaye et al. Performed the first successful transplant for a 7-year-old sickle cell disease patient who had stroke. And the World Health Organization added Nigeria to the map of countries performing stem cell transplantation in 2012. Next slide. I will just briefly, this is not an academic gathering, but I'll briefly go through the process to make it easy. Because when I performed the first transplant, a professor of surgery asked me, who was the orthopedic surgeon in the theater with you? And I said, no, I was there with my resident doctors. Because I know you are not a surgeon. He thought we moved the bone from the donor to the patient. And he was asking for which bone doctor helped me to remove the bone, the donor, and transplanted it to the bone of the patient. It is no, we just take blood. We take the mother hen from the bone marrow and transplant it from the donor to the patient. We'll go through it briefly. So the process, we have different types of bone marrow transplantation. The indication for the use of bone marrow is enormous. Stem cell transplantation is one of them. Blood cancer was the reason why stem cell was developed. But we had a patient that had sickle cell and also had blood cancer. And we discovered that while we were curing the cancer, the sickle cell disappeared because the donor was hemoglobin AA. And since then, we've been using it to cure sickle cell. Next slide. This is the process. We select the patient. We condition by destroying the mother hen of the sickle cell patient. By giving the patient some drugs, the mother hen in the bone marrow will be destroyed. And thereafter, we take the donor to the theater, collect the mother hen with the blood from the bone marrow, and then transfer it to the patient in the ward. And give the patient drugs that will make this mother hen stay in the marrow and begin to produce new blood of the donor. This is how we collect the marrow. In the theater, we just put a needle at the back of the donor like this. The donor is sleeping, and we collect blood. When we collect blood, from that blood inside the marrow, we select the mother hen. Next slide. This is us in the theater collecting the blood. Next slide. This is us. You see us at the back of the patient, donor collecting blood. Next slide. This is our first patient, a 7-year-old child that has stroke that was presented to me in 2011. Next slide. This is our first patient, a 7-year-old child whose mother had 3 sickle cell disease patients. The first one died, the second one died, this third one had stroke, and then I just came back from Switzerland. And I told the hospital management that I was going to do transplant. And we had 10 families come with sickle cell disease patients. He was the first who had a donor. He was already quadriplegic, meaning he cannot move his arms and legs. Next slide. We had to use his brother, who was a 14-year-old boy, that donated stem cells for us. We took him to theater, collected the stem cells. It's safe to the donor. At the next 3 days, the boy went back to the school. And we were able to transfuse him and transplanted him in September 2011. And 3 months after, his genotype has changed from SS to AA. Since 2011, the young man has had physiotherapy, is now able to walk. He has started school. He has not had one crisis since 2011. He has not had one blood transfusion. His PCV used to be 2018. His PCV usually now is 43 and a half. No bone pains, no drugs, no admission, no more troubles as sickle cell. His genotype right now is genotype AA. Next slide. The second young man is a very interesting one. Please go back a little. This is a 15-year-old boy from Edo College. When I did the first and second transplant, the students in the class started collecting money. They were donating, asking their parents to bring money, that they heard they could do a cure for their friend who was a scholar. And they were able to start raising money. The teachers joined gradually. The old boys, including the late Oba of Benin, who was an old boy of Edo College, they went to meet him and he contributed. And the student came to my office en masse and said, I must transplant their colleague. They were able to raise 2 million naira. And I told my management that this boy, we will transplant this young man. And we did the transplant in 2013. Next slide. His sister was the 21-year-old who donated. And by 2013 August, when we did the transplant, the next 3 months, his genotype has changed to become AA. This guy is a scholar currently reading medicine. Since 2013, he has no pains. His genotype has changed from SS to AA. And the question is this: can we actually do better? I told you I spoke at 2015 in Abuja with many of the first ladies, and they were touched. But since then, nothing has happened. I've also spoken now to great senators and honorable great men, and I'm very certain that Rivers State will not be like the other states. I'm very certain that something can be done. I have trained enough hematologists in this country. I have the challenge of leaving this country. From frustration in 2014, when we had issues about doing more transplants. I've done 3, and they're all completely successful. But there's no support from federal government. Even in politics, they use it for campaign. But I'm not a politician, I'm a scientist. I want action. I want an international transplant center. I want to be able to cure as many as possible sickle cell disease patients that require transplant. The quadruplets that you are talking about, they could be cured from sickle cell. So I want to challenge everyone, next slide, and say that this should not be the usual talk. Please, let's put our money where our mouth is. Sickle cell has no politics. I don't belong to any political party, but I'm a scientist. And I say we want to challenge us all here. Please donate and make sure that we bring succor to these brothers and sisters of ours who actually is not their fault that they have sickle cell disease. And with the professionals, we are available to ensure that your money is put to use. Thank you very much.
Thank you so much for that. As educated as I thought I was, I didn't know most of the things that you shared with us today. So on behalf of the audience, I'd like to ask you a few questions. First of all, what is the average cost of the stem cell transplant?
Okay, I will speak when dollar was some 3 years ago when we did the last transplant ago. And as I mentioned, funding has been a problem of reviving the center and other stuff. But as of 3 years ago, transplant was done for $200,000 in Europe. $200,000 in Europe. It's still, most people who travel out knows that it's like that. Yeah. And that's an average of about 80 million naira. Yes, if you are using 400, yes. In UBTH, we were doing the transplant for 5 million naira.
Oh, wow.
And we could, as I said, we had only one transplant room. Since we started in 2011, only one functional transplant room. That means we could do one transplant a year. And we have said that if we have an international transplant center, we could do transplant in batches. And that cost can be reduced to as small as 2 million naira.
Amen.
Because there are some drugs that when we open them once, you have to discard the remaining one. But if we have many patients and we are doing it in batches, we could do 5 transplants at the same time. And the cost, because the generator, you have to run generator for 2 months. And if you have 5 patients, it's the same generator you are running. The cost of generator for 1 patient is about 2 million. So if you are running that for 5 patients, the cost will definitely come down. And we're sure we can do transplant in this country for as small as 2 million naira.
Wow. So if we have regular power, that reduces it by 2 million.
That is it.
That's a government issue. Government has a lot to play here. So I'm so pleased that our distinguished senator is here, because I will bug him for the next 50 years. All right. Are there any age restrictions to the stem cell transplant?
Yes, you see, knowledge is always continuous. And I'm privileged to be a board member of the World Bone Marrow Transplant Council representing Africa. And so I participate in researches that are current every year, both in the United States. And right now, in the past, transplant for sickle cell was 15 years and below. Better as 15 years. But from 2 years to now, we've developed newer methods. And transplant can now be done for those up to the age of 45.
All right. Are you aware of any sickle cell health organization or practicing doctors here in the River Rhine area? Because I hate to hear that everything is out there in the West. Lagos, Benin, Abuja.
No, it's not the West. Benin is Niger Delta.
Ooh.
We are together. Well, I will let you know that part of my joy is not to be the only stem transplantologist. There are some hematologists who have had training, in different places. But my own difference is that I have been able to what we call localize and use local methods. And so I represent WHO in training doctors in other developing countries. I came back from Ghana last year. I was in Ethiopia the year before. So we have doctors who are trained. My last transplant that I did in 2013, I invited all the doctors in Nigeria who are hematologists to participate in that transplant of that 15-year-old boy. We did the collection together. We went to theater together. We did the transplant. They spent 2 weeks with me. And some doctors from Port Harcourt Teaching Hospital were part of the team. And I'm still available in this country to make sure that transplant is something that is available and accessible to all Nigerians that require it.